patient is advised to undergo heart bypass surgery, also known as coronary artery bypass graft surgery or CABG, it can feel overwhelming, frightening, and urgent. But one of the most powerful steps a patient can take before scheduling the procedure is to pause and ask the right questions, because informed patients make calmer decisions, recover better, and feel more confident throughout the process. Heart bypass surgery is typically recommended when coronary arteries are severely blocked, limiting blood flow to the heart muscle and increasing the risk of heart attack, heart failure, or persistent chest pain. And while the procedure can be life-saving and highly effective, it is still a major open heart surgery that requires preparation, understanding, and commitment to recovery. So the first critical question every patient must ask is, why do I specifically need bypass surgery, and are there alternatives in my case? Because not every blockage automatically requires surgery. Some patients may be candidates for medications, lifestyle optimization, angioplasty with stenting, or enhanced medical therapy depending on the number of blocked arteries, their location, overall heart function, diabetes status, age, and overall health condition. And understanding why bypass is being recommended over other treatments ensures clarity and confidence in the plan. The second essential question is, what are the risks and potential complications in my individual situation? Because, while bypass surgery has excellent success rates globally, risks can vary depending on age, kidney function, lung health, diabetes control, prior strokes, or previous heart procedures, and patients should understand possibilities such as infection, bleeding, irregular heart rhythm, temporary memory changes, wound healing issues, or rarely stroke or heart attack, not to create fear but to create preparedness. And when patients understand risks, they also understand how the surgical and ICU teams work actively to minimize them. The third crucial question is, what should I realistically expect during recovery in the first 30, 60, and 90 days? Because recovery is not just about surviving surgery, it is about regaining strength, mobility, and confidence, and patients should know that hospital stay typically ranges around 5 to 7 days depending on progress, that initial fatigue is normal, that chest incision soreness and leg discomfort if grafts are taken from the leg are expected, that walking begins early, often within a day or two, and that full sternum healing may take 6 to 8 weeks, meaning heavy lifting and driving may be restricted initially, and understanding this timeline reduces frustration and anxiety after discharge. The fourth important question is, how will this surgery improve my long-term heart health and symptoms? Because patients deserve to know whether bypass surgery will relieve angina, improve exercise tolerance, reduce heart attack risk, improve heart pumping function, or extend life expectancy in their specific clinical situation, and clarity about expected benefits helps align expectations realistically, especially in patients with advanced heart failure where symptom improvement may be gradual rather than immediate. And the fifth vital question is, what lifestyle changes and medications will I need after surgery to prevent future blockages? Because bypass surgery does not cure heart disease, it reroutes blood flow around existing blockages, but the underlying process of atherosclerosis must still be controlled through cholesterol management, blood pressure control, diabetes management, smoking cessation, regular exercise, heart-healthy diet, weight management, and lifelong adherence to prescribed medications such as antiplatelets, statins, beta blockers, or ACE inhibitors. And patients who understand this before surgery are more likely to commit to cardiac rehabilitation programs, structured walking plans, dietary modifications, stress reduction practices, and follow-up appointments, which significantly reduce the risk of needing another procedure in the future. Beyond these 5 main questions, patients may also ask about the surgeon's experience with bypass procedures, whether minimally invasive options are available in select cases, how many grafts are planned, whether the surgery will be performed on pump or off pump, what type of grafts will be used such as internal mammary artery or saphenous vein grafts, what warning signs to watch for after discharge, when they can resume work depending on their profession, and how emotional health will be supported because temporary mood changes, anxiety, or low feelings are not uncommon after major cardiac surgery. Patients should also discuss support systems at home, ensuring someone is available during the initial recovery phase to assist with mobility, medication schedules, wound care monitoring, and follow-up visits, and they should prepare their home environment by arranging comfortable sleeping positions, avoiding stairs if difficult initially, keeping emergency numbers accessible, and planning nutritious meals that promote healing. It is also important to understand that cardiac rehabilitation is not optional but a cornerstone of recovery, providing supervised exercise, education, and monitoring that safely rebuilds stamina and confidence, and many patients who complete structured rehab report significantly better outcomes than those who skip it. Another often overlooked aspect is mental preparedness, because entering surgery with clarity reduces stress hormones that can impact blood pressure and recovery, and open discussions with the surgical team about fears or doubts can bring reassurance and realistic perspective. In summary, scheduling a heart bypass procedure should never feel rushed without understanding, and asking these 5 essential questions transforms fear into empowerment, confusion into clarity, and anxiety into structured preparation, allowing patients to move forward confidently knowing why surgery is needed, what risks exist, what recovery truly involves, what benefits to expect, and what lifelong responsibilities follow. And when patients approach bypass surgery as an informed partnership with their medical team rather than a passive event, outcomes improve not only physically but emotionally and psychologically, leading to stronger recovery, healthier habits, and a more resilient heart for years to come.